Hello everyone, greetings for the day. I am Sanya from All About Skin Wellbeing. I am sure all of you must be keeping good health. We all know taking good care of skin is most important more than just your appearance. As the largest organ, your skin becomes the most essential to your overall health. A fungal infection is very common on your skin or nails. Fungal infection or mycosis are diseases caused by a fungus, yeast, or mold. Mild fungal skin infection can look like a rash and can be itchy and annoying too. So let's connect today with our skin expert, Dr. Anish Ashraf, live from Cochin, to enlighten us on the topic of fungal. Dr. Anish Ashraf is a consultant dermatologist with years of dedicated experience in treating various skin conditions and enhancing skin health. Currently, he serves as a consultant dermatologist at Kraft Hospital and Research Center. He has many years of experience in this field. He completed his medical education at the prestigious Malankar Orthodox Syrian Church Medical College and post graduation from Trivandrum Medical College. Dr. Anish Ashraf, we welcome you today.
Good evening. Thank you for having me.
Thank you so much, doctor. And as we are going to discuss a very important topic, that is fungal infection, my very first question to you is that what are basically fungal infections?
Now, fungal infections, as the name suggests, are infections that are caused in human beings by fungi. Fungi, are microorganisms. You do encounter a lot of fungi in your normal environment. A lot of fungi around it which are exposed, but not all of them would cause an infection. Usually, when you get an overexposure to a certain kind of fungus or certain species of fungus. And it is usually when your immunity or your defense body's defense mechanism is that you usually get fungal infection. Now, for example, you get a thorn prick. You know that fungi will propagate on organic. You get a thorn prick, there is a small abrasion on your skin. Your first line of defense, your skin is breached. And this allows the fungus to thrive and cause an infection in your body. Usually, when you get an overexposure to certain species of fungi, and when your body's immunity or your defense mechanism is a little compromised, that's when you get fungal infection. Your hair, your skin, it can go beyond the skin and even affect some organs in your body. So that is in a nutshell about fungal infections.
Okay, so that's how we can say that this is what the definition of fungal infection is. Doctor, talking about fungal infection, what are the major symptoms, or we can say the early symptoms of fungal infection, and how a person, can see it and tell, that he or she is having fungal infection and it needed to be treated.
See, fungal infections, well, I'll confine myself to the skin. Dermatologist, I talk about skin fungal. So the most common fungal infection that we encounter is a ringworm. You can see these round rashes on your annular. We call them annular. It's circular with a central layer. So that is the most common sign that you see of a fungal infection. So when you suspect a fungal infection, it's important that you see medical care. And the common symptoms of fungal infection, fungal rash. The most common symptom, of course, is itching. It is extremely pruritic most of the time. It causes a lot of discomfort for your daily life. And you can find some amount of scaling, some redness on the skin. And even sometimes it can go beyond the skin. It can present as a swelling, it can present with discharge when you see a subcutaneous infection or an infection which has gone beyond the skin. So these are the common signs and symptoms that you observe with fungal infections. The the real hallmark of a fungal infection is usually pruritus, intensely itchy, and uncomfortable.
Okay, doctor. So it can be itchy and cause discomfort to the person. So these are the symptoms of fungal infection. Doctor, is it like that? Fungal infections are is having for a person who is moving out or wearing tight clothes, or what are the causes of fungal infection? Are there any dietary precautions one should take? For not having fungal infection, what are the major causes of fungal infection?
See, fungal infections, generally, fungus tend to thrive in a moist environment, a warm and moist environment. So, fungal infections, you asked me earlier, how would you suspect fungal infection? Usually, fungal infections happen in warm and moist areas of the body, like your underarm, your groin, between your toes. where it is usually moist, but it is warm, it sweats a lot. So that is the first thing that you take care of to prevent fungal infection. To keep yourself this dry, not wash yourself regularly, keep the moisture in your body. It can still cause fungal infection. So the important keywords here are clean and dry. And yeah, when you talk to me about clothing, generally we get fungal infection when you wear tight, non-breathable clothes. It's better to wear loose cotton dresses which tends to aerate your body a little bit and prevent moisture from accumulating. At the same time, avoid using damp clothes. Sometimes rainy season, the clothes may not dry well. You tend to wear damp clothes. You should avoid that. And even your towels, once you use your towels, please ensure, not just your towels, your clothes, your bedsheets, your blankets, make sure that you always sun dry them so that moisture is not getting eroded and fungal particles not reaching in these clothes, especially when you have a fungal infection already or someone in your home has a fungal infection. The same with your the footwear. Try to wear breathable footwear. Don't wear too much of occlusive plastic footwear, or don't wear like thick socks. Use cotton loose socks. So things like that. Clothing is important in preventing fungal infections. Another thing is, of course, as I mentioned, you sun dry everything, and it's not sharing things. If you're sharing intimate things like your soaps, your towels, your clothes, avoid doing that, because especially in a season where there is a lot of fungal infection around, you wouldn't want to transmit the infection from you to another person or vice versa. So avoid sharing clothes and and yeah, within a living space, if you're sharing space with someone, there's a good possibility that someone else will be transmitted to you. So you need to take care of that. And about food, it's generally about having healthy food and maintaining good immunity. So, nutrients that uh, your body's defense mechanisms generally do take care of most fungal infections, at least prevent them from being severe or serious. So yeah, it's about having enough of vitamins and minerals and antioxidant-rich food. It's going to help boost your immunity and thus help in protecting you from fungal infections.
Okay, so immunity is the key. If you have good immunity, you can definitely prevent fungal infection. Doctor, these, as you mentioned, that it can, also transmit from one person to another. So, are fungal infection contagious? It can be transferred from one person to another.
It can, as I told you, when you share a common space with a member, your roommate, or someone who's in the house, important clothing, or share clothes, blankets, it can get fungal exposure in one another. Not as contagious as a bacterial infection. This would require contact with the person, immediate contact, or contact with the person who's already infected. So that is usually the way. So we do recommend, if fungal infection at home, we do recommend that everyone takes treatment together. We don't want one person not treated and the other person treated. It can go up and down from there. So we try to treat everyone together when family members are treated, or when hostel roommates are treated, things like that. And we generally advise them to even wash the clothes separately. Yeah, of course, avoid sharing. It is transmissible.
Okay, doctor. So it is transferable if you share a common space, a closed space, as you mentioned. Doctor, sometimes people also don't treat the fungal infection. Instead of, they treat it with home remedies or some any over-the-counter medication suggested by their friends or family. So, what is your advice to the people who don't treat the fungal infection? Instead of they treat themselves, or suggested by some cream or anything suggested by their friend, who take self medication. So, what is your advice to those people?
The biggest issue that we face with fungal infections is mistreatment. And they use a lot of over the counter products or products that you buy to treat fungal infections. And when you mistreat your fungal infections, that's when it gives rise to issues. We can manage fungal infections with the antibiotics and what we talked about. But when you mistreat, for example, as you said, the over the counter drugs, normally what happens is when fungal infections, you go to a chemist and ask for a medicine for itching. You just tell them that it's itching, I need a medicine. So what do they give you? They give you a steroid cream. So most often than not, that's what happens. Or a combination cream. You might have an antifungal, but it's combined with a steroid. You apply a steroid, you destroy the local, and what happens is the fungal infection gets worse, or sometimes really you apply steroid, it comes down. So you feel you get, but the problem is it's going to worsen. The fungus will propagate, and you're going to have a recurrent infection. So even they won't even respond to the normal adequate treatment that we give. So a person who comes to you after applying a lot of steroid and that too potent steroid, it becomes extremely difficult to treat. They're not responding. They're not going to respond to the normal antifungal prolonged treatment. Sometimes give those patients. They sometimes believe that when I applied the steroid, I had some relief. Now you're applying antifungal, I'm not getting effect. That's what happens when you stop a steroid. It worsens. So people feel like the antifungal is worsening, and they tend to go back to the steroid. It becomes an continue with you get recurrent infection. So this is one of the major issues that you find. Please, if you suspect a fungal infection, if you are finding a skin rash which is suggestive of a fungal infection, please make sure that you seek adequate health care. You approach a trained dermatologist or a physician and get the right medicine. Because when you mistreat your fungal infection, that is when the chances of getting recurrent fungal infections happen, chances of complications happen. So please make sure you
Right, doctor. So, as you have given the advice to all the people, do not mistreat your fungal infection. If you are having any kind of symptoms, please do refer to a dermatologist. Doctor, as we have discussed about what is fungal infection, what are the various symptoms of fungal infection, the causes. Now, coming to what are the types of treatment which are available for fungal infection, and how long does the treatment long if somebody because some of the people don't go to doctor because they think that fungal infection take a long time to recover. So what are the precautions and what are the treatment options which are available for fungal infection?
it is true that sometimes fungal infections can take some time to be cured, especially if your immunity is compromised. So, what are the circumstances where your immunity is compromised? This is when usually where you're on some treatments which causes suppression of your immunity, like you're on steroids, certain drugs, or if you have issues like diabetes, or if you have HIV, AIDS, something that affects your body, or just you're ill otherwise, and your body's immunity is a little bit compromised. So, in the such circumstances, your body is not fighting against the fungus. It might take longer for even the medication to fight the fungus. So that's when you would need treatment. And generally, I would advise you to continue treatment according to medication. So if I see a certain condition, if I find that there's a certain level of treatment required, it is very important to follow your doctor's advice. So generally, we start with a 2 week regimen. The 2 weeks we give you cream. We might have to give you tablets, antifungal tablets, depending on the severity. So if you find that after 2 weeks the fungal infection is getting better, doesn't mean that you suddenly stop treatment. That's the mistake people make. Because when you see a clinical improvement, when you see that your rash is improving and your symptoms are better, you're not anymore, people just can just stop the treatment. So what happens is this fungus can leave some spores there on the skin. So the skin lesion is better, but the fungal spores remain. They can lead to cause of recurrence of the fungal infection. So to prevent that, we would recommend you to continue the treatment. At least the topical creams you have to continue for a long time to prevent. Even we give fungal powders. So these are some things that you need to continue for a few months at least to prevent recurrence of fungal infection. Especially if you're exposed to an environment where you're likely to get more fungal you've got a fungal infection, your body already has these fungal spores, and there is an issue already. So it's better to do some amount of prevention through medicines itself, so that you don't get recurrences. So generally, when you get a ringworm, depending on the severity, you get expansive lesions over the body, and you find that your family members are affected, or you're living in a hostel in a close environment, other people also being infected. We generally recommend to take the medicine for at least 4 to 6 weeks. And in my case, at least if we require the tablet, 4 to 6 weeks, and we stop the tablet, continue the treatment for an extended period of time, say for 2 to 3 months. So that you don't get the fungal spores, something that are left over, are also taken. That is extremely important. So follow your doctor's advice in the duration of treatment. Don't decide for your own. The doctor might ask you to come back after 2 weeks taking the medicine. It is initially to assess the response to treatment. And after that, you get good response to the prescribed medicine. further recurrences or relapses of fungal infection. So follow your doctor's advice on this.
Very well explained, doctor, that how medications are important and how one must take advice of a dermatologist. Doctor, a lot of people don't take the full treatment. They think that the rash is gone, the itchiness is gone. They just don't take the antifungal medications anymore. What is your advice to the people who do that?
That's exactly what I said. Some people stop when they find that they are calm down and stop the treatment. So then there are more chances of recurrence. Can fungal infection and start from the beginning again. So to avoid that, as I told you, there can be fungal spores left over. The rash might be gone, but the fungus is still around. When they get a favorable environment or when your body's immunity is compromised, it can flourish again. It can cause another bout of symptoms. So extend the treatment beyond that specific time that the doctor prescribed for 2 weeks. Continue that for another 2 weeks at least, so that you get a long-term cure and prevent the fungal recurrences. So it's extremely important that you do review with your doctor. When the doctor says review after 2 weeks, please do that. Most people don't, and they come back after 3 months with a recurrence. So I've seen that a lot. So it's advisable that when you get prescribed a medicine 2 weeks, the doctor tells you specifically, come back after 2 weeks. Right? Look at the response to treatment and then decide how long to continue so that so managing fungal infections could be a little bit of a long-term thing, but it has to be done to prevent relapses.
Absolutely right, doctor. That it has to be taken care of that. Doctor, here we have also a live viewers question as well who are watching this live. So there's a question that is there a way I can prevent getting ringworm on my feet frequently?
Remember the question is remember the
Yes, yes, doctor.
yeah, ringworm of the feet. As we told earlier, the two things that is to so you have to prevent moist, especially between the most common sites of fungal infection. So for that, what you do is you wear flexible footwear. Then you wear loose, wet clothing. Avoid occlusive materials, plastic. There is still fine. You wear and the socks. You try to use cotton socks. Don't wear warm socks, especially in a warm environment. Your feet are gonna sweat in a very close environment. So keep your feet clean and dry. You wash your feet. Washing alone is not enough. Make sure you dry it up. And that is one main thing you have to do. And avoid walking on especially wet surfaces. Use good footwear, adequate footwear, but at the same time not very occlusive, closed type of footwear. So that is one way by which you can prevent recurrent fungal infection. And of course, take medicine if you are infected, then you have to take.
Okay, okay, doctor. Thank you so much for answering that question. And here comes another question: that if fungal infection left untreated, it is life threatening.
You can't call this only women. Have uh, certain level of your body fight is not life threatening, especially infection. But as I told you, it can go beyond this fungal infection. Not to So there are certain fungal infections which can propagate within your body. It can affect your lungs, it can affect your brain, the different organs of your body. So once it becomes disseminated, then of course it is like this we find usually immunocompromised. Generally, the healthy population is very rare to have a fungal infection.
Okay, doctor. So we have with us Dr. Anish Ashraf today from Cochin, and we're talking about very important topic, that is fungal infection. And Dr. Anish was telling us that how the fungal infection can affect your body. Doctor, can you hear me?
Yeah, we just lost the network in between. I'm sorry. Yeah, so as I was saying, in a healthy person with the amount of immunity, it's very unlikely that a skin fungal infection can be of any threat to your life. But the fungal infection per se can affect the body, and it can cause life. So that is, as I said, immunocompromised, like compromised, that I certain suppressive drugs, medicines, steroids. So generally, in a healthy person, if you get a ringworm or a simple fungal infection, it's likely that it causes complications that can lead to a life-threatening situation. But when it goes beyond the skin and when it starts affecting your organ, yes, it can cause life fungal before there are many fungi that cause a lot of complications.
Okay, thank you, doctor, for answering that question. And we have more live viewers question as we are talking about fungal infection. There's a question that how can travelers protect themselves from fungal infection in tropical climates?
It is the same thing, the same funda. Keep yourself and make sure that you travel the to repeat your clothes, repeat your socks, repeat your footwear. So sometimes, when you repeat them, when you keep your body warm and moist state, and uh, fungal infection. So just follow those principles that I told you earlier. Just keep yourself clean and dry as possible. If you're traveling in a tropical climate, it is important your clothes sun dry. Whatever you're using, all the travel accessories you gear that you're using, allow them to sun dry after washing as much as possible. So then, when if you're traveling in a hotel, you'll be using like towels and that are used in case they were affected by a fungal infection. Hope that they were actually well washed, sun dried. So that is one thing. Whatever, however much possible, the prime things that you're using, the clothes and everything, try to sun dry them as much as possible. Is the one thing that I advise you to do. And as I told you, wear breathable clothes, loose fitting cotton clothes. The same time, wear footwear which are not too oppressive, especially in the tropical country. You tend to sweat a lot. And these sides of your body, like your underarm, your groin, even after breathing, they should be dry. Don't leave them moist. That's when you get a lot of fungus. Then don't share your whenever you travel with family. Try your own things like your own soap, towels. The ones that you use in your body, don't try to share it. So these are some of the things that I advise to everything. With your cap, sometimes you sweat a lot under the or a bit of chance of so, all the intimate objects that you use, even your undergarments, try to always sun dry so that but to feel that they are getting damaged. Or sometimes if you're in a hurry, you'll have to not at least make sure you iron before using it, so that to some extent you can take point. So the fungus, the thing you need to remember is fungus is common body. So if you don't provide fungus the right atmosphere to thrive in, then you have less likely chances to get a contract fungal infection.
Okay, doctor. So sun dry and try to keep yourself more dry. That is one
Yeah,
solution.
clean and dry. Just cleaning alone is not enough. Clean and dry.
Okay, doctor. And doctor, here's one more question from our viewer: that how do you treat a yeast infection?
Yeast infection generally, it's called the yeast is usually the yeast that infects our human body is a candida. The candida, most commonly you find vaginal yeast infections in women, and even in places like your finger webs, your toe webs, you do get fungal infections. So the same basic principle of trying to make you have to use medication. If it's severe, you might have to take oral antifungal tablets. we just require to use antifungal creams as well as antifungal powders. The powders to prevent irritation with the skin, also help to keep the area dry as possible. So that's what yeast infection. You get a lot of vaginal yeast infections, especially during their period. You see some lot of moisture there. They do tend to get yeast infections. So if someone is affected severely with these, we even suggest using and even hormonal changes can cause yeast infections uh, during your pregnancy, during puberty, even hormonal medication, like your birth control pills, that can cause yeast infections. So if you're experiencing symptoms like white discharge from the vagina, intense, if you're experiencing symptoms like that, you need to take care of these medications as well. As I told earlier, yeah, don't wear like damp undergarments or too much tight fitting clothes. And if you're using antibacterials, if you use antibiotics, that can also cause a yeast infection. What it does is it suppresses the normal healthy bacteria in the area and it tends to propagate the fungus or the yeast as in that also is another cause. So if you are aware of any such causes, any such reasons why you're getting recurrent infections, avoid that. And as I mentioned, check your blood sugars. That is one common thing that you find. Someone is infected with candida. The first thing that we ask them is, "Are you diabetic?" Elevated blood sugars, compromised can lead to a lot of yeast infections. So do check your blood sugars if you can. In any part of the body. Genitals is a very common site, as we call them intertribal, like in flexural areas between your fingers, between your toes, especially if your toes are like, if you observe, your toes are very close to the There's hardly any air that gets space between your toes for some people. So they have to be extremely careful about getting infections. And the same with your body parts like underarms, groins. So take care of these things if you're getting recurrent. And do, of course, as I told you, do get.
Okay, doctor. And doctor, as we have discussed about the antifungal medications as well, that for treating the fungal infection, people need to take antifungal medication. So, can oral antifungal drugs can be taken during pregnancy? And how long somebody need to take the antifungal medicines if somebody is having antifungal infection?
For how long? It is dependent on the type of fungal infection. So on how severe it is. So based on that, we decide how long. That's more or less safe, but then there are certain things that you need to consult the doctor for a really long period, depending on the requirement. Sometimes you'll have to check your liver function. As the doctor will decide and monitor accordingly. So don't say so. The best thing would be to consult the doctor and do according to medical advice. If it requires tablets or you would need to consult the doctor. As for pregnancy, for our practice, they just tell the definitely outweigh the risk when you're taking an antifungal tablet in pregnancy. Creams are more or less fine, but not all antifungal tablets are safe. In fact, the best we have is category B, which means that they've not shown any side effects in animal studies, but not convincing studies in human studies. So if it is that severe, if you cannot, if you're not able to manage your daily life because of the cost, if the potential benefits outweigh the potential risks, then you definitely can take oral antifungal, only on the supervision of the doctor. And you need to follow up both the doctor, I mean, you're treating dermatologist as well as the dermatologist. So the blanket answer would be no, don't take oral antifungal as much as possible, but if it is required, there are medicines which can be taken some amount of it.
Absolutely right, doctor. And doctor, any advice you would like to give to all the people watching this live? And if someone is having fungal infection, what advice you would like to give them?
Yeah, but nutshell of whatever I've told so far, important is the right advice. Uh, it is when you mistreat yourself, when you take wrong treatment, that is when the fungal becomes difficult. A fresh fungal infection which not been touched yet by the wrong medicine, it is very much possible to take care. But when you use steroids, when you use the wrong treatment, that is when it becomes complicated. It becomes difficult for you, doctor, as well as for you. It's very distressing, because it can really cause a lot of discomfort in your daily life, work, then you will start itching in your private areas. So it's difficult. We understand the amount of distress and discomfort it causes. So we want people to get quick relief, but the solution should be the right treatment. It shouldn't be like you take a steroid and you get a 10 not going to happen, because that's not going to treat your disease. It's just going to worsen it in future. So seek the right advice, and as I already advised, the things that you can take care of, self hygiene is very important, and also regarding keeping as dry as possible, especially during especially tropical climates, and especially during monsoons. It's very important that certain precautions that you need to prevent.
Okay, doctor. That's very good advice to all the people watching this live. Doctor, we have discussed about the precautions, the symptom, the causes, the treatment of fungal infection. Sometimes people also ignore fungal infection and they left it untreated for a longer period of time. What would you advise to the people who do not take fungal infection seriously?
As I told you, the more you delay your treatment, the more chances that you propagate the fungus. And you can have fungal infection in your body. Take care of everything. If you're not cutting your nails properly, scratch something on your and to other parts of your body. And same time when you use to pat dry your body, use it over a fungal infection, and use it in other parts of the body to propagate that side. Find any evidence of a fungal infection, suspect infection, waiting for it worsen, for the lesion to expand, for the fungus to grow further. So the earlier you treat it, the better. As in any medical condition, the earlier you detect it, the earlier you treat it. That's the best way to go about it. So the longer you delay your treatment, that is going to cause more complications. The treatment is going to take longer, and you tend to have more recurrences of fungal infections. And the fungus tends to establish itself in your body, and even your immune system sometimes get adapted to the fungus. Sometimes you don't respond to the fungus anymore once they propagate. So all these things can happen. So make sure that you don't delay your treatment. Find signs of fungus. Don't wait for it to worsen further with the belief that it might go on its own. Sometimes it can happen. Sometimes your body can give it quite take a chance. At least give it the right treatment, that you'll be fine. So yes, so never delay your treatment.
Okay, so don't delay your treatment. Doctor, any myths or misconceptions you would like to clear about fungal infection?
The misconceptions generally, the usual ones that we get are fungal infections are treated with antibiotics. So and the medicines have a lot of complications, a lot of side effects. So these are some of the misconceptions that we prescribe a tablet. It is an antibiotic. It's not an antibiotic. Antibiotic bacteria and fungi treatment. Both are different. And these are not medicines with a lot of side effects. We tend to believe that medicines for fungal infection have a lot of side effects. Absolutely not. These are very much safe medications that will to cure fungal infection. The other misconception, of course, the most important part is what leads to mistreatment. People tend to believe that you get a cream over the counter and that's going to cure your fungal infection. Never do that. This misconception of using a steroid cream and getting initial relief, people tend to believe that that is the best form of treatment. They keep using steroids forever, and they get recurrent fungal infections, and finally they don't respond to the proper. So they believe that steroids are the way to go. Sometimes they need to, suffer through a period of time where there's no time to act, so that you get long-term cure. Otherwise, you're going to keep getting.
Absolutely, very well explained, doctor. And before we end this very informative live session where we discuss about the precautions, the symptoms, we also have live viewer question. There is one more live viewer question: that can fungal infection be passed from person to person through shared personal items?
Yes, of course. I already mentioned that. Never share with even most common the ones that you the clothes, towel. So try to avoid packing as much as possible. When you share a common space, as I said, or shared personal life is definitely one way to live.
Okay, okay, doctor. And there's one more question: that are there any cultural practices that increase the risk of fungal infection?
What practices?
Cultural practices that increase the risk of fungal infection.
I can't think of certainly of any cultural practices as such. Uh, Audit is practices that uh, your skin moist and warm and toast that can lead to so clothing maybe to try to wear use especially summer even during monsoons. So yeah, that is the only thing I can think of. Some of the whatever causes is environment to the fungus. So you yeah, you can think in those lines and maybe connect with the cultural practice.
Okay, okay, doctor. And before we end this live session, any takeaway message for all our viewers watching this?
My absolute takeaway message is that when you have a fungus, find the right so consult your dermatologist or your doctor and take the right this fungal infection is more or less people. It complicated if you do not treat it the right way from the beginning. So it is very important that you seek the right advice and avoid using over-the-counter cream, even if it is cream. Sometimes people think just a cream, it's not going to cause much harm, but it can cause a lot of harm. You apply steroid cream and your immunity is getting destroyed, your local immunity is getting destroyed, the fungus is thriving in that environment, and it becomes more complicated. So the main takeaway advice is do not self-treat. Please take the right advice, and everything's going to be fine.
Thank you so much, that doctor. That is an absolutely good takeaway message. That do not self-treat, and if you have fungal infection, go and refer to a nearby dermatologist. Thank you so much, Doctor Anish Ashraf, for your valuable time. And it has been very quite informative session for all our viewers, and we really look forward for many more such sessions in the coming time as well.
Thank you very much. It was a beautiful session having I look forward to it. Thank you so much.
Thank you. Thank you so much, Doctor. And thank you so much for all the viewers for an excellent participation. For more information and updates on skin health and care, stay connected on our Facebook page, that is all about skin well-being. We are also available on YouTube, Twitter, and Instagram. Thank you and good day to you all.
Bye bye. Take care.